The following portion of Indy Now is sponsored by MCJR and Ortho Alliance. Joining us to share more about their services is surgeon Dr. Joshua Carter. Dr. Carter, thank you for being here today.
Thank you.
Yeah, absolutely. So could you share some examples of how your specialized approach really helps your patients recover and return to their peak physical performance?
Sure. It is so important to get people back to their preferred level of function, and that's something that we're passionate about at the Midwest Center for Joint Replacement. So I spend a lot of time thinking about how can we get a person not just back to their day-to-day activity, but actually back to more intensive physical activity.
Yeah. Do you have a lot of athletes coming your way, or are you working with some people who aren't as active?
We do all sides of the spectrum, but especially when people are looking for a little higher level of strength or function. We take care of college coaches. We take care of first responders. We take care of people who are owning their own fitness gyms.
Oh, great.
And also people who desire to get back to a really higher level of passion, like golfing and tennis, and even CrossFitters or runners can get back to it. So I think people are really surprised by how freeing and how few restrictions there are after total hip and total knee replacement.
It's true. I mean, when your body is feeling better, your mind, your emotion, I mean, you're so much more able to enjoy life fully, which is great. When it comes to knee and hip replacements, what's the number one thing, doctor, that you want people to know about your approach?
You know, more than the fact that we are hip and knee experts, and more than the fact that we use advanced techniques and pain protocols to help minimize pain, even more than the fact that our surgery centers have done more outpatient total joint replacements than anyone in the state of Indiana.
Wow.
More than all that, I really want people to know that I will care for them like a person, like a family member.
Yeah.
And so that's what I'm really passionate about.
That's great. Let's talk about the recovery timeline, because I know that's probably a question you get asked a lot when it's like, okay, if I'm going into this, and I know everyone's case is unique, but what's it going to be like on the back end? So how do you approach that conversation with, your patients?
We have a really specialized team, and we can do these procedures efficiently and repeatedly. So what that means is the operation itself takes between 30 and 45 minutes, and that's it.
Wow, that's quick.
We do it as an outpatient, so people are able to be home, back on their couch, 4 to 6 hours after the operation.
Amazing.
They've already walked on their own power, they're able to navigate steps. People are generally getting back to driving 2 to 3 weeks later.
Wow.
And most people are off their assistive device within that first month of time.
Fantastic. I know there's a part of the practice that really sets you all apart, and that's your global outreach mission work. Can you speak a little bit about a very special trip that you recently had?
Yeah, so I was able to take a trip to Kenya last year, and this is the second time I'd been to this rural place in Kenya. It's a fantastic place, and it serves the most underserved people really on the planet. Very poor people with terrible orthopedic needs. Not only that, but I was also able to train some of the Kenyan residents who are learning how to be orthopedic surgeons.
Wow.
And so while we were there, we actually were able to do the very first anterior hip replacement that hospital had ever done.
Wow.
And so it was very meaningful and just a joyful time. And I really think that taking that compassion and purpose and bringing it back with us, it really informs how we have patient interactions everywhere, whether it's overseas in Kenya or whether it's right here in Indiana.
That's great. And it's not just you, doctor, on that team that does that global outwork. It's really everyone.
All 5 of the surgeons at the Midwest Center for Joint Replacement are involved in some sort of global mission work.
That's amazing. Well, you can learn more at mcjr.com. We really appreciate you being here, Dr. Carter.
Thanks so much,
Thank
Ryan.
you.
Appreciate
Absolutely. Pleasure to meet you. The preceding portion of Indy Now was sponsored by MCJR and Ortho Alliance.